a psychiatric technician?
A psychiatric technician is a category of mental health professional that is historically like the old hospital attendants. That's who they were in the past. They're the people who do the day-to-day care in hospital settings, sometimes daycare settings, care of mentally ill patients, and care of patients who have developmental disabilities.
How long is the psychiatric technician program, and what can I expect in that?
In the program here at
Yes.
American College of Nursing?
Yes, ma'am.
Our psychiatric technician program is a 12-month program. We have scheduled the hours for evenings and daytime in the weekend. And essentially, the first 6 months of the program is nearly identical to the vocational nursing program here at American College of Nursing. So for the first 6 months, you focus on learning how to give physical care, emotional care to families and patients focused on medical illnesses. That's the first 6 months. In the second 6 months, we focus on individuals with developmental disabilities and people who are experiencing mental illness problems. So for those 6 months, the students in the program will focus on patients who are either dealing with developmental disabilities like autism, cerebral palsy. Sometimes people have accidents that have brain trauma associated with it. Those people qualify as developmentally disabled at times. And people who have really diagnosed psychiatric disabilities like schizophrenia, bipolar disorder. And you'll be dealing with the theory related to care of those patients in the classroom. And in the clinical area, you'll be working on almost a daily basis taking care of patients who are experiencing either one of those two disorders.
Okay. And would you have specific facilities where students would actually do their clinical rotation?
We do. And those facilities can be anything from an acute care hospital for psychiatric people who are experiencing psychiatric disorders, to a day treatment program for someone who is developmentally delayed, developmentally disabled. Or it could even be, because the trend is changing, and most developmentally disabled people are now living in smaller group homes. It could be in a foster home, it could be in a small group facility. And what we try to do, it can even be in the school system. What we try to do is to get you into a variety of settings so that you have an idea when you finish the program what the options are that are available to you. Right now, I think the largest employer in the state of California of psychiatric technicians is the prison system, because there are people who are incarcerated who need mental health care.
Okay. And aside from, like you mentioned, the prisons, is there any other place we could get employment after we finish the program?
Oh yeah, state hospitals, daycare centers for disabled people, the prison system we've talked about. There are long-term care facilities that work with patients who not only have a physical disability but also a long-term psychiatric disability. So it can be in the home. It can be in a group home. It can be in a daycare facility, hospital, long-term care facility.
And what kind of assistance, aside from, of course, the 12-month course, any preparation that students actually have to go through so that they are confident enough to take the boards after the 12-month program?
Well, actually, before you come into the program, there is no prerequisite other than graduation from high school or a GED. Once you have accomplished that, in the program in the 12 months, we incorporate all of the theory that you're going to need to function as a psychiatric technician, providing really competent, quality patient care. We will have a prep course when you finish, and this is what our usual practice is. We have the 12-month program, and then about a 2-week preparation course where you intensively prepare to take the state licensing exam.
Okay. Thank you.
Okay.